John Bakke, owner of Sierra Smiles. We'll have people probably joining us from Tahoe and Reno, Carson tonight. We've gone through a big transformation in our office the last year, especially with COVID. It's made us analyze what's really important, and we have really dedicated to becoming a complete health dental office. And we believe the mouth is a gateway of the body. And there are so many things that we can do to help people stay healthy through this time. There was some research just coming out saying that if you have gum disease, you're 9 times more likely to die from COVID, which is mind blowing. So many of the things that we're talking about tonight not only will help with airway and breathing, but will help with overall oral health, gum disease, and decay. So just a couple of housekeeping things. What we'll do is we'll run through our presentation tonight, and feel free to chat in questions, but we're going to hold any kind of live questions until the very end. This is going to be recorded so we can send it to other patients and people who are interested in what we're doing. And like I said, we want to respect your guys' time tonight. We expect this to be about 45 minutes, and we'll be available at the very end for any kind of questions. We'll also, be giving the phone number and email just in case you guys want to contact us that way. So I want to introduce Lancette. I don't think you guys have met Lancette. She's an amazing hygienist for Sierra Smiles. She has probably done more for the hygiene community in the state of Nevada than any other hygienist out there. She is extremely passionate for dental hygiene and dental health, and especially airway health. The more and more we learn about it, how important it is. She gives back to our community. She gives back to our profession, and she is just an amazing person. And you're going to learn a lot from her tonight, and you're really going to enjoy listening to her. So, Lancette, I'll turn it over to you. Thank you for being here with us tonight.
Thank you so much, Dr. Thank you so much, Dr. Bakke. It is really an honor to work with such an amazing team with Sierra Smiles, and to really see the progressive way of looking at health and, treating our patients like as a whole entire person instead of just body parts. So it was pretty easy to get on board with this new airway program that we've launched because it's all science-based, it's evidence-based, and we really think it's relevant to almost everybody now. So that being said, we'll go ahead and get started. And I did just let a couple more people into the waiting room, so we should be seeing more people join here. So we're here to kind of talk all about breathing, something that we kind of do each and every single day. We wake up breathing, we go to bed breathing, we actually take about 25,000 different breaths a day. But it's probably one of the things that we have never invested any time or training or exercise or practice into it. And turns out with all this new kind of emerging research that many of us may not be breathing to our full potential, which means we could be starving our vital organs and our brain of really vital nutrients and oxygen. So there's actually a right and a wrong way to breathe, believe it or not. And that's kind of what we're going to be talking about today. And what we know with research is that, if we're not breathing properly, whether it's during the day, whether it's during exercise, or even mostly at night when we sleep, it could really lead to some lifetime of mental and physical problems. Right now, we know we have a silent crisis in America with adults and children. If we look at this list here, research has shown that 9 out of 10 people in America suffer from at least one or more of these conditions. So we're talking about attention problems, ADHD, ADD, bedwetting, difficulty learning in school, mouth breathing, snoring, restless sleep, delayed or stunted growth, nightmares, low IQ, chronic allergies, crooked or crowded teeth, small mouths, dark circles under eyes, swollen tonsils or adenoids, daytime drowsiness, depression, anxiety, fibromyalgia, obesity, hypertension, aggressive behavior, bruxism, heart disease, high blood pressure, Alzheimer's, addictions, diabetes, dementia, cancers, and even premature death. And you might be looking through this list thinking that maybe even one of you have one or more of these conditions. So what research is showing us now, though, is that these conditions are really signs and symptoms. The visible symptoms, the snoring, the mouth breathing, being tired, having problems with weight control, metabolism, and things like that, actually might all kind of come from the same underlying cause. that we're really starving our body and our brain and organs of vital oxygen and nutrients that we need, because a lot of us are suffering from a compromised airway. So we're talking everything from the sinuses to the upper and lower jaws to the back of the throat and kind of down the windpipe. We need a lot of airflow to really fuel our body. And research is showing that if we go in and kind of start to really evaluate people's airways, that a lot of us do have a compromised airway. And the compromised airway could be coming from a variety of different reasons, but research is now kind of really linking a lot of it to just the growth and development and kind of how we're made and how we grow and how we develop and how we eat over our lifetime. So you guys might be on the call for different reasons. Maybe you're on the call because you've been diagnosed with sleep apnea and you don't want to wear a CPAP. Or maybe you think you have sleep apnea, but you haven't been kind of brave enough to get the diagnosis yet. Maybe you or your child suffers from bedwetting or getting up a lot in the middle of the night to go to the bathroom. Or you're noticing attention problems or snoring or mouth breathing. Grinding or clenching your teeth, or chronic allergy or sinus problems. We absolutely know that if you're suffering from these types of symptoms, that there are a lot of solutions out there to help you. We know that children and adults now are suffering from poor airway health. 1 in every 15 Americans has sleep apnea, but the really sad statistic is that only 85% of people have been, or 85% of people are undiagnosed and don't even know they have it. 1 in 25 children have sleep apnea right now. And there's lots of breathing disorders when we talk about poor airway health or airway problems. It's everything from sleep apnea to chronic sinusitis, allergies, and asthma. And we know that it can affect people of all ages, all sizes, all shapes, all income levels, and it really doesn't discriminate. Some really sad statistics is the World Health Organization now reports sleep deprivation as a global health concern. The Guinness Book of World Records states that sleep deprivation is now more dangerous than the highest recorded skydiving. And we talk about sleep deprivation means poor sleeping, snoring, walking or talking in your sleep, getting up to use the restroom. When you don't sleep well, that's considered sleep deprivation. You really can't tell if somebody has maybe, disordered breathing or poor airway health just by looking at them. But trained professionals like our team at Sierra Smiles are starting to pick up on a lot of clues. So some medical and physical signs of poor airway health: acid reflux, chronic allergies, asthma, carbohydrate cravings, dark circles under your eyes, digestive issues, frequent colds, chronic head or neck pain, large tonsils, and poor posture. Dental signs. These are the types of things that you're going to notice when you're going in for your dental appointments, especially at our office with Sierra Smiles, that your hygienist is probably going to be talking to you about a lot of things that relate to airway that maybe we weren't talking to you about before because we, maybe just didn't know. Now we know that these are some pretty classic signs of poor airway health, and these are things that we're looking for in your dental appointment. Bad breath, crowded teeth, problems with the bite, excessive tooth wear, clenching, grinding, mouth breathing, small arches, small chins. We're looking at your tongue pretty extensively. How does your tongue move around your mouth? What types of attachments do you have your tongue? Do you have fissures on the tops of your tongue? Does the sides of your tongue look kind of wavy? What is your speech like? What is your swallowing like? Have you had to have teeth removed because you don't have enough space? These are all the things that we know that we're looking at in the dental office now. This is just kind of an example to show you. Excess bone growth. This is a classic sign of poor airway health if you look at the upper right side of your screen. Looking at people's nostrils, we're looking literally up people's noses to see, is one side bigger than the other. Some pretty classic signs that people might have some airway issues. Sleep signs of poor airway health: bedwetting, getting up in the middle of the night to use the restroom, loud snoring, arousal, sleep disturbances, restless leg syndrome, trouble falling asleep. If you lay in bed for long periods of time, you can't fall asleep, or you wake up and you can't go back to sleep. And then mental signs, of course, anxiety, depression, attention, memory loss, and fatigue. Right now, about 70 million Americans suffer from a sleep problem. About 60% have a chronic disorder. And the CDC has said that now this airway health is a public health epidemic. And there's about as many people in the United States with an airway problem or sleep problem that could fill up the whole entire state of Texas. We know that people with moderate to severe sleep apnea are about 4 times more likely to die earlier, 4 times more likely to have a stroke, and 2.5 times more likely to develop cancer. I'm going to try this video here. We'll see if this works. The video is new, but it's really good. Oh, sorry. Get the ad as soon as I can.
My name is Matthew Walker. I am a professor of neuroscience and psychology at the University of California.
I can hear the video, but I can't see it on my end.
Ah, okay, well.
We're back to the opening slide.
I'm so sorry, you guys. I didn't embed the video. It's just the link.
I think if you go back to the share screen option, it will let you choose which screen to share, and it might give you the option to share the video screen. Maybe.
I think you're right. Let's see. Tell me if this. Oh, Sarah, you're awesome. Thank you.
My name is Matthew Walker. I am a professor of neuroscience and psychology at the University of California, Berkeley, and I am the author of the book, Why We Sleep. We certainly know that a lack of sleep will actually prevent your brain from being able to initially make new memories. So it's almost as though without sleep, the memory inbox of the brain shuts down and you can't commit new experiences to memory. So those new incoming informational emails are just bounced and you end up feeling as though you're amnesic. You can't essentially make and create those new memories. We also know that a lack of sleep will lead to an increased development of a toxic protein in the brain that is called beta amyloid. And that is associated with Alzheimer's disease because it is during deep sleep at night when a sewage system within the brain actually kicks into high gear and it starts to wash away this toxic protein, beta amyloid. So if you're not getting enough sleep each and every night, more of that Alzheimer's related protein will build up. The more protein that builds up, the greater your risk of going on to develop dementia in later life. What are the effects of sleep deprivation on the body? Well, there are many different effects. Firstly, we know that sleep deprivation affects the reproductive system. We know that men who are sleeping just 5 to 6 hours a night have a level of testosterone which is that of someone 10 years their senior. So a lack of sleep will age you by almost a decade in terms of that aspect of virility and wellness. We also know that a lack of sleep impacts your immune system. So after just one night of 4 to 5 hours of sleep, there is a 70% reduction in critical anti-cancer fighting immune cells called natural killer cells. And that's the reason that we know that short sleep duration predicts your risk for developing numerous forms of cancer. And that list currently includes cancer of the bowel, cancer of the prostate, as well as cancer of the breast. In fact, the link between a lack of sleep and cancer is now so strong that recently the World Health Organization decided to classify any form of nighttime shift work as a probable carcinogen. So in other words, jobs that may induce cancer because of a disruption of your sleep-wake rhythms. We also know that a lack of sleep impacts your cardiovascular system, because it is during deep sleep at night that you receive this most wonderful form of effectively blood pressure medication. Your heart rate drops, your blood pressure goes down. If you're not getting sufficient sleep, you're not getting that reboot of the cardiovascular system. So your blood pressure rises. You have, if you're getting 6 hours of sleep or less, a 200% increased risk of having a fatal heart attack or a stroke in your lifetime. There is a global experiment that is performed on 1.6 billion people twice a year, and it's called daylight savings time. And we know that in the spring, when we lose 1 hour of sleep, we see a subsequent 24% increase in heart attacks the following day. Another question perhaps is, what is the recycle rate of a human being? how long can we actually last without sleep before we start to see declines in your brain function or even impairments within your body? And the answer seems to be about 16 hours of wakefulness. Once you get past 16 hours of being awake, that's when we start to see mental deterioration and physiological deterioration in the body. We know that after you've been awake for 19 or 20 hours, your mental capacity is so impaired that you would be as deficient as someone who is legally drunk behind the wheel of a car. So if you were to ask me what is the recycle rate of a human being, it does seem to be about 16 hours, and we need about 8 hours of sleep to repair the damage of wakefulness. Wakefulness essentially is low-level brain damage.
Such a good video. That's courtesy of Dr. Bakke. Thank you so much. Okay, back to here. Thank you guys for helping me work through that. I'm really glad we added that video. All right. This is a really interesting kind of just follow up to that, you know, that if you lose just about 90 minutes of that really good restorative sleep, your cognitive ability, your brain function actually drops by 35%. And that's just after one night. So you can imagine if you have those nights at night after night after night. You know, so why do we have so many adults now suffering with all of these, you know, chronic diseases and these symptoms? Well, a lot of researchers are really linking this to growth and development, you know, that we grow at different rates, our jaws grows at different sizes, the container that's holding in our respiratory system is kind of different for all of us, and that many people who are having poor airway health or airway problems probably have underdeveloped jaws, underdeveloped tongues, and underdeveloped facial muscles. I don't know if any of you guys saw this on CBS. This was a couple months ago now. This is a really, really great introduction to how evolution has really changed the way that we breathe and kind of explains why a lot of us are having breathing issues now. Look at this just chronic, change in transformation in the size and shape of skulls over the years, where our skulls used to be very, very broad and big compartments to hold a lot of our airway system in. But, you know, through lack of breastfeeding, soft diets, processed foods and things like that, we've seen a pretty big change in the skeletal system of humans now. This was a really great book. If you guys are looking for some reading material on learning more about, you know, the science of how we breathe and how important it is, this is a great book. But basically it goes on to talk about how all this research about how if we plug the nose and force people to breathe through their mouths, it's linked to all kinds of really massive, significant and fast health problems. So if people are breathing through their mouth a lot during the day, or especially at night while they sleep, it would make sense that, they're more susceptible to chronic diseases. This just talks about, just again, a lot of archaeology and nasal obstruction. You know, when people can't breathe through their mouth, it changes the position of the tongue. It restricts the growth of the jaws, and it's a really, really great reading material. This is another really great photo just to kind of follow up on that image of the skulls, you know, that didn't have any skin on it. So here, just look at the transformation of the face. The nose used to be very, very big and broad, and now look at how narrow, you know, our airway system has come over time. And another sad statistic, about 80% of children right now need orthodontics because their jaws are just literally too small to hold their teeth in. And if we know the jaws are too small to hold the teeth in, then we absolutely know they're too small to hold all those important components of the airway in also. This is another really awesome visual, right? So, you know, when we have people with crowded teeth, of course, we want to move them around and make them look pretty, but really the focus has now shifted on how do we make a bigger container? You know, instead of taking teeth out and instead of squishing those teeth in and making them look nice to fit in this container, you know, how about we look at health in a different way? And why not we make the container bigger, right? Why not we grow and expand the jaws? So not only is there room for the teeth and they look really nice, but there's also room for everything that needs to fit inside of there. This is just some more research from archaeologists, you know, looking at different populations around the world. We know that crowded teeth and small jaws is definitely unique to the Western culture. We know that it's probably contributed to a lack of breastfeeding, inadequate breastfeeding, bottle feeding, produces very interesting swallow patterns for children. And if we look at populations that don't have soft diets and don't have processed food and breastfeed for many years, the jaws are very broad and big, the airways are big, and a lot less statistics for chronic degenerative diseases. So we know that most malocclusion, small crowded teeth, is actually acquired from lifestyle and diet, and is not actually genetics or inherited. We know that these small jaws are very unique to Western culture. And if people have a small jaws, crowded teeth, if you had to go through braces, if you had to have your wisdom teeth out, that you probably have an underdeveloped airway as well. So let's just kind of take a look at growth and development and how it happens, and how it happens so early on in life. You know, by the age of 2, half of the development is already done with the head and neck and skeletal area. So by 2 years, we already have a pretty good idea. About 50% of the growth is done. And we know that the growth is pretty much completely done by age 17. By 2 years old, the head and kind of skeletal area, the airway is about 55% developed. By 4 years old, it's already 75% developed. And by 12 years old, already up into the 90s. So we know that, you know, these young kids, this is the prime time to really work on expanding their airway, not holding teeth back, not moving teeth around, but actually working to grow their jaws and grow their airway while their body is wanting to grow on its own. And we know that healthy skeletal growth is wide, it's forward, and it's downward. So I want to just kind of show you some things also that we're looking at when we're looking at our patients now, adults and children. We're looking at their posture. We know that people who have their head tilted to one side or the other, or they have their head tilted forward with rounded shoulders, are pretty classic ways that we compensate to help us breathe better. You know, we're looking at people's natural resting mouth position. We want the lips to be completely closed. You don't want to see any teeth. And then we're looking at people's chins. You know, look at this boy on the edge here. You know, we would look at him and maybe before we knew much about airway, would think he was a pretty cute kid, maybe a little excess weight, and don't worry, he'll outgrow it. But what we know is a lack of a prominent chin is a pretty significant sign of maybe an underdeveloped airway. And, you know, to kind of give you a perspective of adults, you know, those kids, their airway doesn't get any bigger. So then they grow into adults that have very similar symptoms. Pointed chin. This one in the middle is a mouth breather where you can see all this gummy smile. If somebody has a gummy smile, that's another classic sign of an airway problem. And then, of course, these deep bites. And for many people, we've been doing cosmetic work and trying to make the teeth look really pretty, but not really addressing the underlying root cause, and maybe small underdeveloped jaws and a compromised airway. And I also just kind of want to point out that our tongue plays a really vital role in how we breathe and how our teeth form and the shape of our arches. And so we know that if children aren't breastfed, for instance, they develop some interesting patterns with their tongue, and their tongue stays in the bottom of the mouth and it doesn't go up to the top of the mouth where we need it for proper swallowing. And if the tongue doesn't go up to the top of the mouth, it creates more of this V-shaped arch. When the tongue goes to the top of the mouth and gets to sit there and rest, it actually pushes that jaw growth forward and outward and downward like we like. So this is just a picture of the airway. When we talk about poor airway health, we're talking about the nasal cavity, the sinuses, the upper jaw, the lower jaw, the back of the throat, all the way down here into the bottom of the windpipe. And this is probably one of the most exciting things that we're doing for our patients now is we can do a CT scan of your airway and actually take a look at what's going on the inside. We don't have to just look on the outside anymore. We can actually take a scan and look at your sinuses. We can look at your neck. We can look at where your tongue rests, and we can actually measure how much of an airway space you have. You know, a lot of people with these chronic airway problems like sleep apnea and things have these very tiny restricted airways, where when we scan, they will show up yellow, red, or orange on the scan. And it's almost like it's a tiny, skinny straw that air has to get through. What we really want is a nice, super wide airway. And when we do the imaging, we want it to be all green, right? That there's lots of airflow. We want your airway to look like a big, fat garden hose. So one of the things I'd highly recommend is for you to come back and let us scan your airway so we can actually take a little deeper dive and look at it.
Just a few hundred years ago, the human face was different. It was forward grown. Her wide profile and large dental arches ensured straight teeth and room for her tongue. Most importantly, she had plenty of space behind her upper jaw so she could breathe through her nose with ease. The modern face has changed. From childhood, her dental arches are less developed, crowding her teeth and giving her less space for her tongue, which impacts her airway. Many believe this stems from a number of causes, such as allergies that affect breathing. Another is the poor nutrition and softness of modern diets, causing toddlers to have underdeveloped chewing muscles and smaller dental arches. Because her upper jaw is too far back, she will struggle to breathe normally through her nose. To get more oxygen, she will compensate by opening her mouth to breathe, bringing her lower jaw down and back, creating a downswing of the face. This is how her undergrown upper jaw creates the appearance of buck teeth. She's actually compensating in order to breathe. If not corrected, the problem carries into adulthood. Extractions were documented in the 1600s as a way to treat crowding. Although they are a quick fix, they don't treat the problem of underdeveloped arches and have been implicated in harming the facial profile, making them the subject of much debate even today. Adulthood. In order to breathe, she will slouch her head forward to prop open her airway, creating a lifetime of neck and back pain. This is the infamous forward head posture. Having a healthy airway is crucial to the survival of life, and especially so during sleep. When muscles around the throat relax during sleep, a healthy airway stays open because the tongue is sitting forward and has enough space to be suctioned up against the fully grown palate. With underdeveloped jaws and dental arches, the palate is too small for the fully grown tongue, which is sitting back to begin with. When she sleeps, her tongue does not suction, rather it falls back and cuts off her airway. This is obstructive sleep apnea. Like crooked teeth, it's a modern condition, however, it can reduce life expectancy. Not surprisingly, obstructive sleep apnea is marked by the same traits that describe the headgear effect. Both jaws are grown down and back, creating a clockwise rotation in the lower third of the face. The myth of the overgrown upper jaw that needs to be held back has long since been replaced with science. Science has shown that young children can be buck-toothed naturally, and that the lower jaw catches up over time with a fully developed upper jaw. Essential to this is nutrition, the use of chewing muscles early on in life, and good breathing habits. This means breathing through the nose with the mouth closed and the tongue resting up against the palate. Also, the practice of maxillary expansion has been shown for over a century to correct crooked teeth and improve nasal breathing space. And since 1918, orofacial exercises have been shown to correct mouth breathing habits.
This is another really good video. This is not one of our patients, but it is from a mom that just goes to kind of show, how dangerous it is when children can't breathe and how they might go through these periods where their brain is not getting oxygen. And if the jaw is moved forward and put in a more ideal position, it totally opens up the airway.
Still holding his breath, and I was going to gulp again. There he goes. That was it again. And again. He's holding. He's holding. He's trying. There he goes. So this has been 3 minutes and 15 seconds, and you can see how many episodes he's had of not getting calm breaths in. Now, watch what happens when I take his jaw and I just bring it forward. If I can. Let's see if I can. And I open his airway. Just bringing his airway forward. Now listen to the quiet.
So we know, that if we can move that jaw forward and get the tongue out of the way, that is a really great way to help improve breathing. But what we really want is for that to be a permanent thing, right? And not just temporary fixes to make that happen. So, it's super important for us to breathe through our nose to be healthy. Breathing through our mouth, we have a lot of problems with dryness, with inflammation, making more susceptible to chronic diseases. We know if we breathe through our nose that it warms up the air, it warms it by about 20%. It humidifies the air, it gives it lots of moisture, so it's warm and it's moist. It thins mucus and secretions. So then, this air that comes through our nose can be released throughout our body and be used much, much more efficiently. When we breathe through our mouth, the air is very cold, it's very dry, and our body doesn't use it as efficiently as if we breathe through our nose. So one more video to kind of show you guys. This is another kind of a quick one just to talk about attention deficit disorder and what happens to our brains and how it can be related to ADD and ADHD.
Now take a child, alter their quality of breathing and sleeping. And the real big issue now is how will they be during the day? So now you take a child who's 5, 6, 7, 8, it doesn't matter. Their issue has begun years ago. So it's not like you had 1 or 2 bad nights of sleep. You've had a poor quality of sleeping and breathing for years. And the parents have been struggling with so many different issues, and not the least of which is the ADD, ADHD discussion. Because the child who doesn't get a proper night's sleep with a good quality of breathing throughout the entire night is going to wake up and be unrested. And when you get a child who's had a poor quality night's sleep, poor breathing all night long, and you make that happen for years, you know what you've got? A 6, 7, or 8-year-old that's going to go to school and have trouble learning, have trouble sitting still, have trouble behaving, have trouble cooperating, basically have trouble fitting in to what is supposed to be a quiet and peaceful and learning environment. And it's not long after that where the phone call comes to the parent. And when the phone call comes to the parent from the school, what happens is, we have little Jimmy here and he's a little bit disruptive and we really want you to have him evaluated for ADD and ADHD. They're going to be diagnosed with ADD and ADHD. And our solutions are pharmaceutical. If we are given a pharmaceutical, it's usually in the form of some sort of a stimulant. And what that does to the child is it kind of pushes them over the edge and it brings them back to calm. So you basically take an excited or hyperactive child, you stimulate them more, and you bring them back to a so-called calm. But it doesn't make a better learning child. You're not going to have a child who's able to learn as well. Now you might have the child sitting still in class because they might be a little more numb or relaxed or calm, but it doesn't necessarily make them a better learner. If we have the so-called ADD, ADHD diagnosis, we're talking about hyperactivity. We're talking about all of the things about behavior and development that land in this category. And the interesting thing about research is, and there is current, ongoing, and past research that shows, children who are sleep deprived produce the same exact symptoms as kids who are diagnosed with ADD and ADHD. In fact, there's a nice study that showed children who were diagnosed with ADD and ADHD were mixed with children who were sleep deprived. And in that group of kids, when they tried to analyze them and look at their symptoms and diagnose them, they couldn't tell them apart. And if you have a group of kids and you can't tell apart who's an ADD child and who's a sleep-deprived child, it's no surprise that maybe the ADD and ADHD has a cause. And maybe the cause has to do with the quality of the breathing and the sleeping overnight.
I think that one is so interesting. Like, I never get tired of watching that video. When we look at bedwetting and a frequent nighttime urination, again, could very, very highly be linked to episodes of sleep apnea or mouth breathing. We know that the body isn't getting enough oxygen. There's too much carbon dioxide, not enough oxygen. Our blood becomes a little bit more acidic. This sends our body into this kind of really big phenomenon, this, fight or flight syndrome. Your heart rate first drops and then it kind of spikes. And all of this kind of signals our body to do kind of interesting things, like to pull oxygen from the bladder, to try to get our body to eliminate sodium. And some of these symptoms manifest themselves of having to get up to go to the bathroom or bedwetting. So now might be thinking like, oh my gosh, what does my airway look like? What about my child? What about my spouse? Or what about me? What's going on with my body? I want to know. And what can we do about it? And, you know, when you come into our office and have an airway discussion with our team, you know, there's all kinds of different things that might be unique to your situation. So without gathering a lot of information, we don't know your situation or how we can help you, but we have a whole host of things that we're willing to help you with. One thing that we've been talking to our patients a lot about now is mouth taping. I don't know if any of you guys have started taping your mouth shut when you go to sleep at night. Yes, there has. So I know when Dr. Bakke first told me to tape my mouth shut, I was like, I was a little offended, but now we know that there's tons of like really amazing health benefits that if we tape our mouth shut, it helps us know, can we breathe through our nose? Do we have the ability to breathe through our nose? Or is there a blockage? Or is it just habit, right? Have we just started to breathe through our mouth out of habit? So you can tape your mouth shut. When you're watching a movie in the evening, maybe when you go to bed, you can try it with your children. We also have a really amazing myofunctional therapist that we work with. She does therapy specifically to teach people how to swallow, how to breathe through their nose, how to, you know, free up that tongue and get that tongue moving around like we need it to. So these are just some of the options that we could talk to you guys about. And of course, there's a lot of focus going on right now about nasal hygiene. You know, how do we keep this respiratory system that we have? If you guys have never tried this product here in this middle, this clear spray, you can get it on Amazon. It is absolutely amazing. And there's tons of research coming out now, how this actually might help reduce people's chance of getting COVID. Knowing that if we can keep this upper respiratory system healthy, especially that nose where all of the air is coming in, we need all the bad stuff to get filtered out, all the bacteria, viruses, and fungi to get filtered out so it doesn't go to our lungs. This clear spray is a really fantastic product. And then, of course, you know, maybe some of you have been diagnosed with sleep apnea and have a CPAP machine, and this is something that you have to rely on for the rest of your life. And what we are really committed to doing is finding alternatives for people not to have to be on medication, not to have expensive surgeries, and not to have to be hooked up to machines for the rest of their life. We are really trying to be innovative and forward thinking on, you know, how people might be able to get rid of these machines. You know, back in the 80s, there was a very popular surgery, orthodontic surgery, where they would actually break the jaw and try to physically move it forward. That's obviously super invasive, very painful, and the results weren't really that great. So that's kind of gone by the wayside. And then probably what's one of the most popular things right now is a mandibular advancement device, something that you wear at night for the rest of your life that kind of pulls that jaw forward and gets that tongue out of the way to open up the airway. These are a great temporary option, but this is something that people, you know, have been dependent on every night. And we're trying to get people off of these types of things. We really want a more permanent solution where we are expanding the jaws and opening up the airway physically, so we're not relying on so many other things to help people breathe. So what our focus is really on now is how can we expand the arches, right? How can we stimulate the bones to grow? We know we can do that by stimulating stem cells. We can grow new bone and we can grow and expand the airway. And we're doing that by having people wear appliances at night while they sleep for maybe like 12, 18, 24 months. So what we really want to do is grow the arches, grow new bone, expand the arches wide and forward. We want to promote really healthy nose breathing. We want to retrain the tongue so people have nice, strong facial muscles and for swallowing, and of course, eliminating bad habits. This is a picture of some of the devices that we are making for our patients. There's upper ones, there's lower ones, there's ones that cover both the top teeth and the bottom teeth. But the technology is really pretty amazing. And it is all about stimulating your body's own stem cells to grow new bone and expand the arches. You can see these specialized springs right here. These appliances do not hurt. They do not work by pressure. It's not like orthodontics. It is wearing something at night while you sleep to stimulate your body to do what it was supposed to do many years ago. And these are just some pictures. We're just going to go through these really fast and we're almost done. But this is a really amazing transformation. Hunter age 10, you can see the before on the left and the after on the right. And look how nice his teeth look. Look how nice and wide this jaw profile looks. But what's really amazing is after 10 months of treatment, he stopped wetting the bed after just 1 week. pretty phenomenal. This is another one that's really awesome. I mean, her teeth look amazing. This is not with orthodontics. This is with wearing an appliance at night while sleeping. But look at her facial profile. Look how nice and wide her facial profile is. And look at her chin. She did not have a chin before, and she does now. This is the boy we saw at the beginning, age 9. This is him after age 14. Again, look at the nice wide jaws and this amazing transformation with the chin. And we know when we see these remarkable things on the outside, we can only imagine how awesome it is on the inside. This is, again, his teeth. This is not orthodontics. This is wearing an appliance at night. But what I wanted to do is show you what's going on the inside. On the left side of your screen here, this right here is his tiny, tiny, skinny straw airway, these tiny sinuses up here. And then look at this one on the right. This is after. Look at this airway. It's nice and black and big and broad. It's like a garden hose. And look at these sinuses, nice and big. These are the containers that hold our airway. This is another before and after. She came in, wanted braces to fix her gummy smile, but instead she got treatment for airway, no braces. She wore an appliance at night for 12 months and was able to totally get rid of her gummy smile and was able to relax all of these really tight facial muscles, also improved her headaches and her TMJ symptoms. This is a picture of a before and after of a dentist who went through treatment. And then look at her airway. On the left, we'll see all that red means the airflow was not going through after 15 months of treatment. Look at how nice and fat and broad her airway is. These are like permanent solutions to help people with their airway. And this is a really remarkable transformation too, because we are seeing it on the inside where it counts, but we're seeing it on the outside. Look at her before. After 1 month, she was seeing improvement in her symptoms. After 5 months, a lot of improvement in her symptoms, and her facial profile was starting to change. But look at after 12 months, she almost looks like a totally different person. Nice, big, wide profile and a much healthier airway. So we are really excited to chat with you guys. If you want to share this information with your friends and family, it's very, very exciting. If you decide that you would like to come in and talk with us a little bit more, every case is different. We have lots of opportunities to educate you, to take some measurements, to take some scans and see if there's anything that we can do to help you. So if you're interested, the next step in this whole process would be to schedule what we call a records appointment. That's about 1 hour at our Reno location. That 1 hour is pretty jam-packed. We do a lot of medical and dental kind of evaluation there. We take diagnostic photos of your face and your body and your posture and your teeth. We do a comprehensive head and neck exam, taking a whole bunch of measurements inside your mouth, looking at your tongue and your jaws and things. And then we'll do that CT scan. Well, we'll be able to actually measure your airway. The CT scan gets read by a board certified radiologist. We also send you home that night with a sleep test, and your sleep test gets read by a board certified sleep physician. And then all of this gets compiled with our doctors and a team of specialists to develop a report on what's going on in your mouth. And then you come back and go over all that with one of the doctors, and you guys brainstorm about how to get you breathing better. So I'm just very excited to get to be the educator in all of this. I also might be the one that's doing your records when you come back, and our doctors, especially Dr. Baki, has just been phenomenal and is helping so many people already. So if there's anything that we can do for you, please let us know. And here is our phone number if you don't have it already, 775-313-9383. And you can also type stuff into the chat box if you want us to reach out to you or you want to give us some information, and we'd be more than happy to help you there too. So we can answer questions, we can talk, we can brainstorm, and I'll kind of pass it over to Dr. Baki now.
Yeah, guys, thanks for attending tonight. We wanted to use this as a, informational meeting and let you know that, our goal is to prevent people from ever getting to that point using CPAP machine. We realize some people are already at that point. And, we can get people past that and help them develop airways so that they can get rid of their CPAP machine. So it's not possible in all situations, but in many of them we can. So some of the tips and techniques Lancette was talking about, with mouth taping and breathing through the nose, they can make a big difference in themselves. And the CPAP machine and the oral appliances, they help out, but they're almost like a Band-Aid on the real problem. We're trying to get down to the real problem and fixing it for people. And what you see here is a very in-depth screening. And believe me, this is something that the office does not make money from. This goes to cover our costs because we're paying board certified physicians to read this stuff and the home sleep test. It's more for getting the proper information we need to really be able to diagnose things correctly. And, you know, if it's not something we can help you with, this is all information that other physicians or specialists could use too to help with the situation. So if you guys have any questions, we would be happy to answer them now. I will, I'll put my personal email in the chat box if you guys have any questions that you would like to ask me personally, privately. And again, thank you again for taking time out of your night to be with us. And we're here for you guys. You know, our goal is to give people information to help them be as healthy as possible. And I hope we've been able to do that for you tonight to help you out a little bit.
Yeah, and if you want to ask questions, just unmute yourself. I think you have the ability to do that. And thank you, Sarah, for the tech support.
I have a question.
Yeah.
So just I have a health savings account that I can use for medical purposes, but not for dental. So would this be considered a dental visit or a medical visit?
Great question. This initial visit would fall under more of dental. We can bill out medical codes for some of the stuff. And when we really get into the medical insurance, so we're working with a company that is billing medical insurance for the treatments that we do. But some of that is based upon what we find in the records. If the board certified sleep physician finds sleep apnea or upper airway restriction, or the radiologist finds a restricted airway or enlarged tonsils, or some kind of medical necessity for the treatment we're going to do, it's possible that medical insurance will help out with some of those fees. And then again, we're billing these out as medical fees. I can talk with our billing specialist to find out about the health savings account. I would think some of this would qualify for sure, but let me check on that for you just to make sure.
Yeah, it's a good question, Sarah. And the reason why we need the records appointment is part of this is a lot of documentation for medical necessity. And it really is geared to help get as much coverage for therapy or treatment as possible. So that would come from medical insurance.
And I have a question. Can you work with somebody that's in their late 60s? Would any of this help an older person?
First of all, you're not older. Is this Lucinda?
Yes, it
is. Well, Dr. Rocky can probably elaborate, but we're working on very young patients, 4, 5, 6, all the way up to any age. And Lucinda, I know you have lots of years ahead of you.
Well, thanks. Okay.
Yeah, absolutely. What we can do can benefit you. Just by trying to redevelop the archway of the teeth or open up the airway, and then some of the kind of the coaching that we can provide to help breathing and maybe some diet stuff certainly can help people at any age.
Okay, thank you.
Any other questions?
Yeah, I have. I've had a sleep study done in the past, and I can get you those records. If that's the case, does the home sleep test still happen?
How long ago was the sleep test?
2012.
I think it would be very good, useful information to have, but I would expect that insurance would need something more recent. A lot can change in 8 or 9 years, and we want, personally from a practitioner, I would want more recent data. I mean, you could have lost 30 pounds since 2012, or you could have gained 30 pounds, and that has a big influence on your sleep. Clenching, grinding, wear of teeth. There's a lot of different factors. So I think it'd be useful information, but we would definitely want to get something that's more recent.
Okay.
All right. Well, thank you guys so much for your time. Thanks, Dr. Vaki, for hosting us. And I hope to see you guys in our office. I'm not joking. Getting that image of the airway is pretty phenomenal. And we have found all kinds of really interesting things. So I highly recommend it.
So would we just call up the office and ask to schedule a records test? Or
yes.
What is that what
Yep.
it's called?
Just a records appointment, or that you attended our, virtual online meeting about breathing and you'd like to have an image done. They'll, you can say anything like that. They'll know. Our number is 313-9383. Or you can put your information in the chat box and we can have somebody from the office reach out to you. We'd be more than happy to help.
If you do call, just make sure that you mention airway records.
Airway.
Oh yeah, not orthodontics, right? Airway, yes.
Yeah.
Say, I want to breathe better.
Okay, guys. Well, thank you very much for attending. Feel free to reach out to me if you have any other questions. And it's phenomenal what we've been able to learn and how we're able to influence people's lives. I mean, I'm seeing it with my own kids. The transformation we've had is phenomenal, not only for them, but us as parents. We see that they're sleeping better. A lot of the bedwetting night terrors have gone away, which is mind blowing. And we're really guiding their airways into a position that's going to allow them for success in the future. So like Lancette said, this is all ages. From 3 or 4 years old, we start to recognize these things all the way up to, really any age. So thanks, guys.
All right, good night.